we've been around since 1947. We're the umbrella organization for all health and human service agencies. We have a network of over 200 agencies that we do advocacy and policy, we do direct services, and we do sector-wide planning. And we always do it in collaboration together with our network of agencies. And so when the Social Care Network opportunity came around, we were the obvious lead entity to apply for Long Island. So, we've been using Unite Us since 2017, 2018. We're longstanding partners. And I think the thing that's attracted us the most to it in terms, it's not just a technology platform, but you guys are really you're partners with us, doing this work together with us week in and week out. Since 2017, 2018, as we've built our network and built trust and collaboration and partnership in our network, Unite Us has been right there with us every step of the way. Every meeting and every time we've brought folks together and done capacity building and training, Unite Us has been with us doing that work. So for Long Islanders, housing is always a significant issue, and we're really excited for the Social Care Network to be able to provide some rental assistance, utility assistance, as well as housing remediation services, because housing, affordable housing is a tremendous issue on Long Island as well as the rest of New York State. And then really being able to access care in an integrated way. We do not have public transportation on Long Island. So when individuals need to access multiple services, they need to go from CBO to CBO to CBO. But a platform like Unite Us cuts that down and allows individuals to be able to tell their story once, what their needs are, and then that information goes into Unite Us and those referrals occur, and that person is able to access multiple services without having to go from one place to another with their families and their children, and being able to identify ways in which to address the transportation needs. Certainly for community-based organizations, not having to do that traditional email or call or sticky note here are your referrals, go off and access services on your own. They're able to utilize the referral platform to send referrals to colleague organizations that we're convening with Unite Us on a regular basis. We're talking about workflows. We're talking about process and training together with our CBOs, with our other providers, and with Unite Us on a weekly basis, and then being able to streamline and connect a Medicaid member or client to those services and be able to close the loop and know that those services were provided. One of the meetings that we have on a monthly basis is called Unite Long Island, where Unite Us comes and gives us an update on what are the latest kind of intricacies of the platform and do some training and updates. And folks are constantly commenting at those meetings how easy it is to use the platform. It's very user-friendly, and they're really appreciative of the work with Unite Us to really build out those workflows and integrate it into their current systems. Kind of what I was saying before in terms of transportation, especially on Long Island, where we really don't have public transportation, and we're spread out. It's that suburban sprawl that you've heard about, I'm sure, where you have individuals that are having to navigate through multiple communities in order to be able to access services. Unite Us cuts that down and allows the platform to do the work for the individual. Really, it's partnership, right? And because Unite Us has been with us since 2017, 2018, when we first started the Health Equity Alliance of Long Island, coming to the table with us and building out partnership, collaboration, and trust. I always say all of this work stands up and breaks down at the speed of trust. And Unite Us understands that and puts in the work to partner with us and build those collaborations. And we're really appreciative of that. And it's really has allowed us to be in a position where we have the CBOs that are part of the partnership and know Unite Us and know the players of Unite Us and know us together as a unit. And so we're really, they see us together, Unite Us and the Health and Welfare Council's lead entity. We're one unit, and we're really able to interchange one after the other at our meetings and be able to provide that support to our CBOs. I'll often talk about, the single mother who has children, and again, the transportation issue and being able to go to, bring her children to one organization to act as an entry point into Unite Us or into our system of care, and being able to tell her story without having to reiterate her story over and over again. That's, so traumatic and debilitating for an individual. And then really being able to access a multitude of care over a very short period of time, and to not have to, and for that CBO to know that those resources are available and being able to connect her with them.